Hi everyone, welcome to researchmd.com. We got a great presentation. We're going to teach you all about neuroleptic malignant syndrome, a very, very important topic with deadly consequences usually. So all our talk is going to be like teaching everything you need to know under 9 minutes. All our presentation is going to be under 9 minutes with very, very important points, so you know everything about the subject in a short period of time. Again, my name is Pramil Cheriyath. I'm a program director, internal medicine residency program, transitional residency program, and I teach medical students and medical residents. I'm also director of research. So let's get into our subject. Anytime, any topic, what exactly is neuroleptic malignant syndrome? We need to know the definition. Again, it's a life-threatening, even though it's rare, okay? And usually the use of any group of antipsychotic drugs or major tranquilizers like neuroleptic can cause it. The syndrome is characterized by high fever, stiffness of the muscle, altered mental status, paranoid behavior, and there's like autonomic dysfunction. So epidemiology, if you look at it, men are higher risk than women. Incidence is like 0.02 to 3% among the patient taking antipsychotic agents, very high. The results of the main thing we need to know is like dopamine D2 receptor antagonism. That is the principal pathophysiology behind it. Okay, so let's look at how the symptoms are caused. What is the pathophysiology? Was kind of each symptom category. Again, blockage of dopamine in the dopaminergic pathway. Okay, so first you got blocked sites of synthesis and release of dopamine, such as like example, substantia nigra, where the dopamine is produced, right? Inhibit the signal to nigrostriatal pathway and basal ganglia. So you got problem with the coordinating motor movement. You can have extrapyramidal symptoms like muscle rigidity, inability to initiate movements. The next step, again, blockage of dopamine, dopaminergic pathway causes like blocked ventral tegmental area, dopamine signal to the cortex like mesocortical, amygdala, hippocampus, and you can have like mental status changes. The next one, again, is you're blocking the dopamine transmission from arcuate nucleus to hypothalamus to pituitary, which is involved in the hyperthermia mechanism by elevating the temperature set point. So patients have high temperature and impaired heat loss mechanism, vasodilatation and sweating. And the last, you got the inhibition of the nervous system, increased sympathoadrenal hyperactivity, increased autonomic dysfunction, then associated with the blood pressure change, increased heart rate, and increased respiratory rate. Now let's look at the drug. We already talked about very high in antipsychotic drug. Which are the antipsychotic drugs? We have to be very careful. Aripiprazole, chlorpromazine, clozapine, fluphenazine, haloperidol, olanzapine, paliperidone, perfenazine, quiripine, risperidone, and thioridazine. Now, let's look at the antiemetic agents. You got domperidone, droperidol, metoclopramide, it's also called Reglan, chlorpromazine, and promethazine. Okay? Now, let's look at the signs and symptoms. What are the major classic triad? Three things: fever, muscle rigidity, altered mental status. Okay? You can pretty much say the patient have any of the classic triad: fever, muscle rigidity, and altered mental status. Other symptoms: diaphoresis, we talk about the autonomic dysfunction, dysphagia, tremor, incontinence, psychomotor agitation, coeluria, tachycardia, tachypnea, respiratory distress, increased labile blood pressure, hypoxemia is there, delirium progressing to lethargy. So let's look at how do we diagnose neuroleptic malignant syndrome. The DSM criteria is given here: development of severe muscle rigidity, elevated temperature associated with the use of neuroleptic medication, 2 or more of the following, and they put the symptoms together like diaphoresis, dysphagia, tremor, incontinence, mutism, tachycardia, elevated labile blood pressure, leukocytosis, laboratory evidence of muscle injury, at least like creatine kinase. And the symptoms and criteria, we got A and B are not due to or another substance or a neurological other general medical condition. Okay, the symptoms and criteria A and B are not better accounted for a mental disorder also. That is the DSM criteria. So what do we recommend? We recommend you doing this international expert consensus criteria, which is called IEC. Look at the positive likelihood ratio, 7.48. So it's a very strong test. If I had to recommend something, I would, if you're suspecting, do this international expert consensus score criteria. If the score is like greater than 75, you got sensitivity is 69%, and specificity 90%, positive likelihood shows 7.48, my friend. That means your odds go to like 30 to 40% higher. So use this test, very, very important. If I'm writing a question, I would ask about international expert consensus criteria. What are the things in there? Exposure to dopamine antagonists, right? Hyperthermia, rigidity, all of this thing given, and points are given from 20 to 5, 7, 10. And then you add it up. If it is greater than 75, that is very high likely this patient have it, okay? Lab values, always remember to check CK. That's going to be typically very high, not like 200 or 300, up to, it can go like very high, and then white blood cell count can go up to 10,000 to 40,000. You can have hypocalcemia, hypomagnesemia, hypo and hypernatremia, hyperkalemia, metabolic acidosis, and the diagnosis, again, a diagnosis of exclusion. So mainly you have to take the history and the physical examination. Clinical examination is very important. Brain imaging and lumbar studies are required. Again, diagnosis of exclusion. Remember that. You're excluding all the other causes. So that's what you do in brain and the CSF studies. Treatment, the first step is like cessation, like you stop the drug, offending drug. That's the number one thing you have to do, okay? Supportive care. IV hydration, because you got high levels of CPK, system can shut down. Bromocriptine, dopamine agonist, dantrolene, and muscle relaxant, those are the main thing, is kind of important. The bromocriptine dose is geared, dose is like 2.5 milligram. And dantrolene is with a skeletal muscle relaxant, doses 1 to 2.5 milligram G. And all of this, if it doesn't work, you can use the electroconvulsive therapy also, but it's in the resistant stages. If you try the bromocriptine, you try the dantrolene and it doesn't work, then you can try the electroconvulsive therapy also. There is some roles for like benzodiazepine, like for the symptomatic support, okay? Thank you so much for watching. We'll be back with another presentation. Greatly appreciate if you could subscribe to our channel. Thank you.